The area of interest that I chose to look into for the article assignment are Wilms tumors. Wilms tumors are tumors that grow on the kidneys of young children. The first article I found was titled Wilms tumor, and it was written by Stephen W. Leslie, Hussein Sajjad, and Patrick B. Murphy. Its last update was published May 30th, 2023. This article explains that Wilms tumors are the most common abdominal cancer type in pediatrics. It explains that tumors are usually found in children under 5. After this, the article explores the cause of the tumors using genetic terminology. It continues on to note that the survival in the U.S. is about 92%. It lists the stages of development, complications, and the chances of recurrence. My stepdaughter had this kind of cancer as an infant. Luckily, she was cured of the tumor. This article benefits the individual because it explains facts about the disease and treatment options that are available that you can use to kind of go after this kind of tumor. It explains survival rates and the causes of the tumors. However, this article is not completely helpful for patients and families because of all of the medical terminology that is used in the article. It makes it a little bit difficult to read. A normal person, a typical person, couldn't understand much of the article without having to then research all of the medical terms that are used in the article. The second article that I looked up comes from nature.com, and it was written by Filippo Spreafico, and it was published on October 4th, 2021. The title of this is also Wilms tumor. The article began with a complicated abstract full of medical terminology. The rest of the article also included medical terminology that was difficult to understand. So it began with an abstract that right off the bat was full of medical terminology, and then later on it just kind of continued on throughout the article. The article dictated the survival chances of children with this cancer and the tumors, and it explained about effective treatments for the cancer. It also described that the cancer's prevalence varies for people based on their ethnicities. For my stepdaughter, her treatment included both surgery to remove the entire kidney as well as chemotherapy. She went through chemotherapy first for 6 weeks, and it did nothing to shrink the tumor and nothing to change the situation. And then they found out that her kidney was actually just not functioning at all, so they then removed the entire kidney. The article contributes to the study of Wilms tumors, but I don't think it contributes as much to the patients or families of those affected by this kind of cancer. The terminology was very confusing, very complicated, and much of it went over my head. It wasn't anything that I could understand. I could pull out bits and pieces and kind of make sense of what it was saying, but I couldn't figure out what much of it meant. I had difficulty reading most of it. I do not believe a family would find this article helpful. Anybody who was just finding out that a child had been diagnosed with a tumor or the cancer would be able to get through this kind of an article. The final article that I read and researched was again titled Wilms tumor. It was written for kidshealth.org, and it was medically reviewed by an Amy Anzalati. It was reviewed in November of 2022. The article is broken down into 6 sections, 6 headers, and each section discusses a topic related to the tumor. The topics are: what is Wilms tumor? What are the signs and symptoms of Wilms tumor? What causes Wilms tumor? How is Wilms tumor diagnosed? How is Wilms tumor treated? And what else should I know? This article describes that the cancer is often found by stomach palpitations and that there are often no other symptoms. It lists the symptoms that may occur in children that do have other symptoms, such as blood in the urine or nausea, a lot of nausea. It discusses the causes and how the cancer is diagnosed. And it goes on to discuss treatment plans. And finally, it supplies links to additional information for families that are looking for additional places where they can find reliable information. When my stepdaughter was diagnosed, it was found during a routine well-child exam. The doctor was palpitating her stomach, just as any normal visit, and they found a hard lump in her stomach, and they went ahead and did x-rays, and the x-rays came back showing that there was a tumor on her kidney. She was there on a Wednesday, and by the Friday they were at Riley's getting their treatment plan together for her. And she was, I believe, 8 months old. This article does benefit the individual because it is clearly organized and it's very easy to read. It has simple and concise language. It answers many of the questions that people may have when they're going to look up this kind of cancer. And I believe that it would be very helpful for a family and for patients with the disorder, cancer, because it's very easy to understand, it's easy to follow, and it also provides additional helpful information. So I do believe that this article is probably the best one that I found.